the term that's thrown about a lot is orthobiologics. And the bottom line is we're taking cells from your own body, concentrating them, and then re-injecting them into areas of your body like joints where there's arthritis or tendons where there's been injury.
We have blood-based injections as well as bone marrow aspirate injections that we can use to help to target pain issues.
A lot more recent literature is showing things like platelet-rich plasma or bone marrow aspirate concentrate can last 12 to 18 months for these same sorts of problems for arthritis, but then also in injury, actually heal the injury sometimes without surgery. So that's kind of a game changer.
We start by taking your blood from your arm in the office, and we spin that down in a specialized machine called a centrifuge, and the blood products are separated out. Once we separate out your blood products, we remove the red cells, and what we're left with is your body's own natural plasma. That's rich in growth factors, healing factors, and platelets. Platelets are our body's natural signaling factors, and they help to harness all of the good cells to come into the area to help to reduce inflammation, help with pain. And then we inject that back into the joint. We do that under ultrasound guidance because that helps to improve safety, accuracy, and efficacy and make sure we're putting the product directly where we would like it to go. And then what you can expect over a period of 4 to 6 weeks, you get gradual reduction in your pain without the use of cortisone, without the use of any other injection. And without any type of surgical intervention.
The other things they do is they have a variety of growth factors in them that can not only stimulate healing, but decrease inflammation. So they can kickstart the healing process in an injury, and they can also decrease inflammation in an arthritic flared knee per se. Bone marrow aspirate can do the same things because it has concentrated platelets, but the other thing the bone marrow has is stem cells. So when we can spin those down and concentrate that, the stem cells can help not only decrease inflammation, but help also kickstart healing in the tissues. And depending on what the pathology is, we would determine to do one or both of those.
What we know is that PRP is most effective in the more early stage arthritis. If we think about arthritis as early, kind of middle of the road, and severe or late arthritis, the literature has shown that platelet-rich plasma is more effective in that early, kind of mild to moderate arthritis. For tendon injuries, similar, right? Depending on the length of time your tendon has been bothering you, depending on the amount of damage in your tendon or muscle, sometimes we don't get the complete relief of your symptoms. But for most patients, we are able to see some benefit. And your individualized treatment plan, we would go over those details. So with this type of treatment, we don't burn any bridges for any other type of treatment. So this is one option. If we do this treatment and it really helps and it's effective, typically you only require one treatment. We don't do a series of treatments, but should your pain recur from your arthritis 6 months, 1 year down the line, we can certainly repeat it. Should you decide to go on to a surgical intervention or try another option, that's always an option too. So it really doesn't stop you from doing anything.